Hello, my name is Helena Valkowiak. I'm a Principal Technical Advisor for USAID's Systems for Improved Access to Pharmaceuticals and Services program, otherwise known as SIAPS. I've been providing technical assistance in pharmaceutical system strengthening for over 17 years. Today I'll be presenting the work we are undertaking to develop metrics for tracking progress made in strengthening pharmaceutical systems with a focus on low and middle income countries. The title of this webinar includes What Gets Defined Gets Measured, because the development of metrics to measure the strengthening of this critical subsystem of a health system has first meant coining a definition and constructing a measurement framework for pharmaceutical system strengthening itself, including critical system components, attributes, and desired outcomes. After completing this webinar, you will be able to discuss the rationale for developing metrics to measure pharmaceutical system strengthening, define a pharmaceutical system and pharmaceutical system strengthening, identify a pharmaceutical system's components, attributes, and outcomes which are critical for guiding the measurement of progress in improving such systems, and discuss the identification and piloting of indicators for pharmaceutical system strengthening. As you will see, pharmaceutical system strengthening involves certain concepts that are distinct from the way we look at broader health system strengthening and supply chain strengthening. By way of background, USAID's Office of Health Systems, through which the agency provides global leadership and technical expertise in health system strengthening, tasks SIAPS with developing a measurement framework and corresponding indicators for monitoring and measuring whether investments in pharmaceutical system strengthening are contributing to the development of stronger, more sustainable pharmaceutical systems. SIAPS is the current phase in a series of USAID programs that have worked since the early 1990s to improve pharmaceutical management so that people can access the essential medicines, vaccines, and pharmaceutical technologies they need, and that these medicines meet quality standards and are used appropriately. This is a key function of any health system and fundamental to improving health outcomes. SIAPS is led by Management Sciences for Health and implemented with the partners and specialized resource partners you see listed on this slide. All but one of these organizations contributed to this work. An extensive body of work on access to and use of medicines resulted in an assortment of tools measuring various elements of pharmaceutical systems. However, until now, there has been little attempt to conceptualize a pharmaceutical system as an entity, and there is no clearly defined framework or agreed upon approach to measuring progress towards stronger, more resilient pharmaceutical systems. The narrow focus of available tools limits their value in ascertaining which interventions result in stronger, more sustainable systems. The absence of clear definitions and reliable measures creates a critical information gap. Countries and donors lack information to guide investments in pharmaceutical system strengthening and in the tools needed to evaluate related interventions. Two important principles are guiding our work. First, we are seeking to advance the current thinking of pharmaceutical systems by building on existing approaches to health system strengthening. And second, for pragmatic reasons, we have limited the scope of our work to pharmaceutical systems, although we fully recognize they are embedded in and influenced by broader health systems. The first step towards ensuring that we are measuring what matters is having conceptual clarity about what we are trying to measure. Therefore, the first step in our work was developing clear definitions of a pharmaceutical system and pharmaceutical system strengthening. Without this, we cannot evaluate whether interventions are having an impact and resulting in stronger, more resilient systems, rather than simply supporting systems in the short term. And while we have some tools that look at distinct parts of a system, we also need to look at the system as a complete entity. I will now discuss the systematic approach we undertook to first define a pharmaceutical system and pharmaceutical system strengthening, and then to develop a measurement framework and identify corresponding metrics. To begin the process, we conducted a literature review and drafted a background paper to guide a consultative meeting that convened more than 30 participants representing 13 different organizations working to improve access to and use of pharmaceuticals in low and middle-income countries. The participants included representatives from SIAPS partner organizations, USAID, the Pan American Health Organization, who represented WHO, and the Boston University School of Public Health. The objective of the meeting was to bring about consensus on the definitions of a pharmaceutical system and pharmaceutical system strengthening, and the pharmaceutical system components that are necessary for measuring the strengthening of these systems. We reviewed 8 relevant definitions and also 7 frameworks, 6 of which are shown here. The 7th is the Monitoring and Evaluation Framework for Health System Strengthening, which is based on the WHO Health System Building Blocks framework. These frameworks are a mix of conceptual and operational frameworks that vary in scope and focus. With respect to goals of this subsystem, although none of the frameworks explicitly describes the pharmaceutical system, a consistent theme is improved access and use. Our review of definitions and frameworks revealed a wealth of information and also the lack of consensus that currently exists. The image you see shows the domains we reviewed to derive our definitions. A pharmaceutical system is commonly described in terms of its functions or decision points, for instance procurement, and system components such as human resources. With respect to what is accessed and used, the terms medicines, pharmaceuticals, medical products, vaccines, and technologies are not clearly defined and are often used interchangeably. These are definitely not interchangeable terms. For example, health technologies include pharmaceuticals and devices, but also procedures and organizational systems used in healthcare, which are usually considered to be outside the scope of a pharmaceutical system. Our review also highlighted the importance of considering pharmaceutical services. So what is a pharmaceutical system? Our definition proposes that a pharmaceutical system comprises structures, people, resources, and processes. Then, recognizing that a pharmaceutical system is a subsystem of a health system, our definition also includes the interactions that these 4 components have with the broader health system. In terms of goals, the primary aim of a pharmaceutical system is to ensure equitable and timely access to safe, effective, quality pharmaceutical products and also related services that promote their appropriate and cost-effective use. We believe the term pharmaceutical products is sufficiently inclusive and identifies clear boundaries for the goals of a pharmaceutical system. Our definition incorporates related services and describes use as cost-effective and appropriate rather than rational. As Mariam Bigdeli and colleagues pointed out in their 2014 WHO publication, Medicines in Health Systems, use may be rational from the user's point of view, but not necessarily appropriate. For example, it may be a rational decision for a parent to buy a medicine that stops diarrhea so their child can go to school, although oral rehydration salts, ORS, which rehydrate the child, would be more appropriate. Our definition also recognizes that the ultimate goal of a pharmaceutical system is to improve health outcomes, even if multiple determinants of health make it difficult to directly attribute positive gains to the pharmaceutical system. In the absence of any definitions of pharmaceutical system strengthening, we reviewed 3 definitions of health system strengthening, all of which talk about improvement, with the ultimate goal of improving access or health outcomes more broadly. The WHO 2007 definition refers to the achievement of sustained improvements. We can all agree that pharmaceutical system strengthening involves improving performance, but is that all? The health system strengthening literature offers the perspective that strengthening also includes improving resilience, or the capacity to address future health challenges and sustain improvements. The literature on resilience and its measurement is still emerging. We see resilience as a key characteristic of a well-functioning pharmaceutical system, and so the concept of resilience is embedded in our definition. We also note the distinction between strengthening interventions and interventions that support a system that rely on continued external inputs to sustain improved performance. Making this distinction requires clarity about the target or endpoint for a strengthened system. That is, what does a strengthened system look like? This slide shows the system components, attributes, and outcomes that we identified for measuring pharmaceutical system strengthening. In other words, this is what we want to measure. Working backwards, let's first look at the endpoint of pharmaceutical system strengthening. The primary system outcomes are access, which refers to affordability, acceptability, geographical accessibility, and availability, and use, which refers to prescribing, dispensing, and consumption by the patient or administration by the end user. Next, let's consider the system attributes. We identified two attributes that are essential for measuring pharmaceutical system strengthening. Performance, which includes efficiency, quality, and responsiveness, and resilience, which, based on the definition developed by Crook and colleagues, is the capacity of the pharmaceutical system to prepare for and effectively respond to crises, maintain core functions, adapt to changing circumstances, and transform when social and economic conditions make the existing system no longer feasible. Resilience is at the core of sustainability, or the capacity of the pharmaceutical system to function effectively over time. Finally, let's discuss the components of the pharmaceutical system. Given the interactions with the larger health system, it is not surprising that several of the components correspond to the building blocks from the WHO Health System Framework. Two provisos are important to note as you think about these components. First, they're not intended to be an exhaustive list of what constitutes a pharmaceutical system. Rather, they're meant to guide the measurement of pharmaceutical system strengthening and provide a high-level picture of the functioning of the pharmaceutical system as a complete entity. Second, we recognize that a 7-component model cannot capture the full complexity and interactions of a pharmaceutical system and its relationship with the larger health system. That said, a very comprehensive and complex model would hinder us in developing practical measurement tools. Now let's review the components. The pharmaceutical products and related services component is at the core of the pharmaceutical system. It encompasses the functions of selection, procurement, and distribution of pharmaceutical products and related service delivery strategies and interventions that support appropriate and cost-effective use of products. The policy, laws, and governance component is the hub of coordination for the system and directly interacts with all other system components. It provides the framework for organizing, financing, and regulating the system and coordinating the activities of the various institutions and actors to achieve the system objectives. A related component, regulatory systems, focuses on ensuring the safety, efficacy, and quality of pharmaceutical products and related services. Innovation, research and development, manufacturing, and trade represent the entry point for pharmaceutical products into the system. It includes research and development, domestic manufacturing capacity, and intellectual property protections that shape innovation and trade and affect access to pharmaceutical products. Financing refers to the management of resources to ensure adequate and sustainable funding for pharmaceutical product purchases and other costs associated with system functioning. It also involves financial risk protection strategies and controlling costs and prices to reduce financial barriers to access. The human resources component ensures the availability of adequate numbers of appropriately trained staff for managing the supply and delivery of pharmaceutical products and services. It takes into account the people who make the system function. Information refers to the generation and dissemination of timely, accurate, and reliable information to support decision-making. Information is essential to all other components of a pharmaceutical system. Some of the system components we identified are well known. They've been studied extensively and have tested assessment tools and indicators associated with them. For example, the pharmaceutical products and related services component. Indicators for others, such as the innovation, research and development, manufacturing and trade component, are few or limited in their scope or have not been well tested. To begin our process, we reviewed 47 of the 56 assessment tools identified in our literature review and compiled categories of indicators and survey questions which we used to derive first the components and then the elements of each component that are critical for measuring pharmaceutical system strengthening. We also created a database of the more than 1,000 existing indicators included in these tools, which we then sorted into the various components and their elements. Following this, through deliberation with subject matter experts, we identified a set of indicators to be included in a data collection and management tool that we are piloting. I'd like to hone in on one of the components, regulatory systems, and explore it in greater depth to give you an example of how the metrics that we are piloting were identified. I'll discuss the critical elements and indicators for this component. As a reminder, well-functioning regulatory systems ensure the safety, efficacy, and quality of pharmaceutical products and related services. We identified 6 key elements that pertain to regulatory systems. These are product assessment and registration, licensing of establishments and personnel, inspection and enforcement, quality, safety and surveillance, regulation and oversight of clinical trials, and control of pharmaceutical marketing practices. The elements provided the foundation for the selection of 3 types of indicators. Structural indicators provide information on the system's capacity to achieve the objectives of each component. They tend to be yes or no indicators and are the easiest to obtain data for, but they only get you so far. Process indicators assess the degree to which activities necessary to attain the objectives are carried out. Process indicators, therefore, may be more useful for tracking the strengthening of a system. However, they're generally harder to get data on. Outcome indicators measure the results achieved for each component. Let's drill down to the first element, product assessment and registration, for which we identified 6 indicators. We selected 3 structural indicators. First, there is a defined structure with clear responsibilities to conduct registration and marketing authorization activities. Second, there are legal provisions for marketing authorization. Third, there is an updated list of all medical products granted marketing authorization that is regularly published and publicly available. We identified 1 process indicator, the average number of days for decision-making on a medicine application for registration. And we defined 2 outcome indicators. First, the percentage of medicines on the essential medicines list, the EML, that have at least 1 registered product available. And second, the number of products registered. A pilot to validate the measurement framework and the feasibility of data collection of all indicators using a prototype data collection and management tool is currently ongoing in Bangladesh. The methodology entails 2 in-country data collection methods. First, existing or secondary data from publicly available documents, and second, key informant interviews with staff from various government agencies whose work is related to pharmaceutical management, for example, national regulatory agencies, central medical stores, as well as health providers and select patients in both private and public health facilities. After the pilot, we will finalize the data collection and management tool and accompanying user manual so that they can be disseminated globally. To conclude, our work has contributed the definitions of a pharmaceutical system and pharmaceutical system strengthening and a measurement framework that provide the conceptual clarity and basis for identifying indicators for tracking progress towards stronger and more resilient pharmaceutical systems. For those of you who would like to read more about the work of SIAPS in developing definitions and a measurement framework for pharmaceutical system strengthening, the manuscript can be downloaded for free from the Health Policy and Planning Journal at the link shown on the slide. SIAPS would like to thank the individuals and organizations listed for their valuable contributions to this work.